So starting your Geneo treatment, you're going to go into the manual button. We're going to click Oxygenation to program step 1. So for this, the intensity will default to a 4, which is a pretty good place to start. We can always increase or decrease during the treatment if we need to. So we'll leave it at 4, and we're going to set the time for 8 minutes and go ahead and press the play button. That's going to queue it up in the computer. It's not going to start the step. A little message will pop up asking you to make sure that the right head is attached to the handpiece. So we will grab our OxyPod and attach that. This little packet is garbage. I do like to keep the serum bowl because I will actually use this to put the serum or the primer gel in once we start. We're always starting our treatment on clean, dry skin. She doesn't have anything on right now, so we're just going to do a quick wipe. Then I'll take my primer gel. I always like to give my client a heads up that it's going to be a little bit cold. This is going to get painted all over the face in a nice thick layer. And so the primer gel is going to act like a buffer and a catalyst, so we want to make sure that we have enough primer gel on the skin to keep the OxyPod from being too abrasive, but also so that we get lots of bubbles, because the bubbles are what will lead to oxygenation. Once you've got a nice thick layer on, you'll grab your handpiece, hit the power button, and when we start out, we want to introduce it kind of slowly to the client's skin. Initially, the pod will start out very smooth and start to break down as we work through the step. So while the pod is smooth, sometimes we recommend starting either on the forehead or doing a quick swipe under the eye. We're moving very slowly here, not too fast and not using a lot of downward pressure. We want to be careful just to let the OxyPod glide across the surface of the skin without adding too much pressure behind it. So you can work in small circular motions, you can move in kind of sweeping linear motions. The most important thing at the beginning is to do one full pass of the entire treatment area. This triggers the oxygenation internally on the entire face, so we want all those benefits happening for as long as possible during step 1. If you have clients with active breakouts or any sensitivity during this step, you can utilize a stamping method, which will still trigger oxygenation. We can see little bubbles forming around the base of the OxyPod. That's good. We want to see that before we move on to our next stamp, but this allows you to treat over any little breakouts or sensitive skin without as much abrasion behind it. So it's going to feel a little bit more gentle and be more gentle on the skin. Once we're ready to finish the treatment, we'll go ahead and hit the power button on the handpiece. During treatment, if we need to increase or decrease intensity, we can do that with the plus or minus button on the handpiece itself. If you have clients with more sensitive skin, you would decrease your intensity. If you have more resilient skin or body areas, you would want to increase the intensity. Once step 1 is completed, we're going to do our best to remove as much residue as possible from the skin. So you could use a hot towel, you could use sponges, wipes, whatever you want to do. Most important thing is just to make sure that you get as much off as possible, because we don't want any of that mixing with the serum in step 2. Once all the residue is removed, we can go ahead and proceed into step 2. Now that we've got all the residue removed from step 1, we'll go in with our ultrasound. So we're going to select ultrasound from the treatment screen. We're going to program it for 8 minutes. For ultrasound, we want to be anywhere between 6 and 10 minutes. So we'll program for 8, and then we're going to press our play button, come over to our client, and get all the serum applied to the skin. So again, I'm using that little plastic cup that the OxyPod came into, one less thing to clean. And we're going to use about 50% of what's in that serum packet for step 2. The remainder will be saved for step 3. I do like to apply the serum with something non-absorbent. That way all of the serum ends up on my client's skin and not trapped in the bristles of a brush. But there is really no right or wrong, total personal preference. And once you're ready to start, you grab your ultrasound handpiece. One side of the handpiece has a power button. The other side only has indicator lights, so make sure when you're looking at your ultrasound handpiece that you are pressing the power button. The other two lights are indicator lights, which will tell you if there's not enough pressure being applied to the skin or not enough medium on the skin. So when we initially start out this step, I like to just do one full pass everywhere, a little bit more quickly than I would really like to treat. And this is just to make sure that every little area that the ultrasound tip comes into contact with has serum on the skin. Otherwise, the stainless steel can kind of grab and it feels a little bit abrupt. So we want to make sure that we have nice glide over the entire area. And initially it's going to start out a little bit cool, but about 30 to 60 seconds in, it will start to warm up. So you want to let your client know that they should start to feel a nice gentle warming sensation. In our ultrasound, we use strictly for sonophoresis, so we're using these ultrasound waves to push the product into the skin. So when we're treating, we want to work in nice slow motions, really giving time for those waves to do their job and saturate the skin as much as possible. Once you finish your ultrasound step, you'll go ahead and reholster the handpiece. So following our ultrasound, we're going to go ahead and apply the remainder of the serum and then start with our Neo massage step. Now that we have the remainder of the serum applied, we'll go ahead and attach our Neo massage tip and program in our Neo massage step. So we're going to select massage. We'll go ahead and roll with the 4 intensity. And for time on this step, we're going to be anywhere from 6 to 10 minutes. So we'll set it for 6 today. Press play. I'm going to come back over to my client. And this is the same applicator that we used for step 1. So we're going to hit the power button. So this is our Neo massage step. We have a little vibrating wand here that's going to help encourage the facial muscles to relax. We're also going to focus on working out and away from the center of the face. This is going to help with lymphatic drainage, which is going to give your client a nice sculpted, well-rested look afterwards. Once the step is complete, the system will give you a 1-minute warning, letting you know that you have a minute left to even out the treatment or cover an area that you might not have gotten to. And then it will ding again at the full end of the step. So at the end of step 3, we're going to go ahead and take all the rest of the serum off. The reason we want to do this is because the product has had time to kind of dry down on the skin over the course of the last 2 steps. So removing any of the residue will help prevent any pilling of the product. Once we have a nice clean slate, we can go in with some additional serum and then our finishing products.